My name is Sean Wally. I am a health educator. Young teens spend the majority of their days at school. Health educators' primary role should begin by knowing their students, being aware of their interests, and through sincere communication skills, building interpersonal relationships that create trust through being an active listener, having acute observational skills, and having the ability to speak to students honestly and effectively. Understanding the physical, biological, and emotional changes that middle school students go through, being sensitive to psychological issues and confusion regarding identity development, and having awareness of signs of mental and emotional disorders are all skills a health educator must have. My more informal title for this presentation would be Establishing Good Maps is the most essential aspect of promoting wellness. Unfortunately, suicide all too often fails to be prioritized as a major public health problem. Despite an increase in research and knowledge about suicide and its prevention, the taboo and stigma surrounding suicide persists, and often people do not seek help or are left alone. And if they do seek help, many health systems and services fail to provide timely and effective help. Suicide among 10 to 14-year-olds have doubled in the last 7 years in the U.S., and the suicide rate among LGBTQ youths is 4 times higher than compared to heterosexual peers because of risk factors such as mental illness, depression, substance abuse, discrimination, and bullying. Suicide is a leading cause of death worldwide. The CDC reports suicide is the second leading cause of death among persons aged 10 to 24 years old in the United States. Between 1999 and 2014, the number of girls between the ages of 10 and 14 who died by suicide tripled from 50 to 150. The CDC does not have relevant cases to report. However, many different experts believe that the primary social determinants are listed below. Here's the social ecological model table, which illustrates the significance of both the active and passive exchange between individual, relationship, community, and societal factors that influence human development. The individual level examines the personal history, biological and psychological characteristics, gender differences, and individual synchronicities of the individual. The interpersonal level involves the influences of people that have immediate contact with the individual. Family, friends, peers, and school all comprise those interactions that make up close relationships with teens. The adolescent school is an essential part of the student's community. A social climate that positively reinforces or ignores bullying incidents may contribute to the reluctance of victimized children to tell their parents or school representative about their victimization, and ultimately hinders health and can lead to suicidal ideation. On a community level, the media plays a significant role in influencing adolescents regarding potential suicide. Media is considered a determinant of suicide because it stimulates those already susceptible to committing suicide. Newspaper and television news coverage of suicide can truly hinder health by glorifying news of a suicide, presenting too many details, or sensationalizing suicide through excessive reporting. Knowing the facts should raise awareness. Statistics indicate that overly easy availability of guns greatly hinders health and enable teens easy access to a lethal weapon. Families who have guns need to make sure of the safe storage of these guns to avoid easy access of them. Policymakers need to make stricter gun access laws. This would go a long way of reducing suicide by firearms. For any intervention to be effective, all stakeholders must be aware of not only the warning signs the student manifests, but be aware of the protective factors listed that help to reduce suicide, ideation, suicide attempts, and completed suicide. There are many potential interventions because of the multidimensional nature of all individuals. The evidence-based programs chosen are because they are best suited for adolescents in the United States. CAST is an NIH-funded, evidence-based program designed to be a school-based suicide prevention program. It is a 12-week program made up of a small group of at-risk teens. The program promotes a training and social support intervention that builds positive psychosocial outcomes. Research has proven that the program's outcome has reduced suicide, risk behavior, depression, anxiety, substance abuse, and increased problem-solving and coping skills. The CAST program can easily be adapted for middle school students. Getting students together to open up and discuss their issues is a great way to establish connections and not feel so isolated. The initial one-on-one motivational interview with a trained therapist builds empathy and support. The merit of the CAST program is that it builds self-esteem and personal strength through adult and peer support. It is also essential that all gatekeepers go through mandatory training process, learning how to motivate this population, learn about the initial questionnaires provided for the students, how to reinforce problem solving and coping skills, and how to set up support connection with someone the student likes and is willing to go to if she is struggling, emphasizes the importance of making meaningful interpersonal connections. Learning how to go for help-seeking behavior can be the difference between life and death. The program is focused on long-term change that creates a safe and positive school climate. It is designed and evaluated for use in elementary, middle, junior high, and high school, K through 12. The program's goals are to reduce and prevent bullying problems among school children and to improve peer relations at school. The All-Wise program has been implemented in more than a dozen countries around the world and in thousands of schools in the United States. A comprehensive approach that includes school-wide, classroom, individual, and community components. Research indicates that persistent bullying can lead to or worsen feelings of isolation, rejection, exclusion, and despair, as well as depression and anxiety, which can contribute to a suicidal behavior. Bullying does not cause suicide, but contributes to multiple risk factors that comprise suicidal ideation. Evidence-based anti-bullying programs like the All-Wise program reinforces the themes from the CAST program and addresses the overall goals of building meaningful connections and reducing feelings of isolation. Promoting the program to the student population is critical. It is a whole school systems change program at 4 different levels: school-wide, classroom, individual, and community. Both evidence-based programs require the support of the entire school community. By improving the school climate, the students build problem-solving skills and in so doing create stronger personal self-images. This improved environment builds personal relationships and reduces social isolation. The clinical results showed that the combination of medication and CBT is the most effective clinical intervention option. CBT replaces negative thoughts with more positive ones. The goal is to have school-based programs serve as an effective deterrent to suicide, but one must be able to know when to intervene when a situation becomes critical as well. Knowing when an at-risk student needs medication and to see a psychologist can be the most helpful intervention. Implementing stricter waiting periods and restricting easily acquired permits can make gun accessibility harder to acquire and diminish acts of suicide. Qualitative data that is collected through participant observation and interviews with at-risk students will reinforce meaningful evaluations that measure sustained suicide reduction behavior. Using qualitative data from all sources to fine-tune evaluations, meeting with trained faculty and staff, and meetings with students to continue ongoing dialogue for improvements. The primary goal of this intervention is to help to reduce depressed state, improve their mental health, and reduce suicidal ideation. Students' behavior noticeably improves and the crisis subsides. One can feel confident that the student was directed towards a healthy intervention. Learning the value of this type of medication and therapy helps to reduce the stigma attached to mental health issues in the school community. Less completed suicides with firearms indicates success. The collaboration of all stakeholders is a committed requirement. Suicide prevention, especially with teens, requires a consistent understanding of intervention strategies that need to occur collaboratively. This is an interdisciplinary issue that requires government, healthcare, education, police, NGOs, parents, student leaders, religious leaders, and community leaders to work together to save lives. The goal of the logic model is to reduce teen suicides, morbidity, and to get at-risk students to seek help. The interventions build self-worth, problem-solving skills, and create a place for teens to communicate and not feel so isolated. Thank you.